we'll skip the intro. Oh, there we go. Things catch up. Got it. Great. And we'll move right into approving the minutes. We have a quorum, I think. Let's see. It's always fun counting squares. 1, 2, 3, 4, 5, 6. Yes. So is there a motion to, are there any changes to the May minutes? No, hearing none. Can I get a motion to approve the minutes?
Motion to approve.
Thank you, Libby. And a second? I'll second that. So can we vote in the chat whether you say aye or nay to, or whatever, to approving the minutes? Okay. 3, 4, 5.
Carla, if you could do your vote to everyone, you did a direct message, just so it's public.
Oh, thank you.
Thanks.
Thank you very much. I didn't know the setting was, yeah, I see that. Okay. Just. And is it interesting that it, oh boy, okay, that it did that. And defaulted to you. Okay, so minutes approved. Thank you very much to everyone. And now we'll move on to the public health update. If Dr. Cassier is on, there you are. Thank you.
Hi, everyone. Yes, we just got our numbers. Now we update once a week on Wednesdays. And unfortunately, we're still seeing the upward trend. The last number we have is 10.3 per 100,000. This is being reflected throughout the state, probably throughout the nation. And it's probably due to the subvariants of Omicron, which are more contagious, but hopefully not as serious. We have not seen an a small increment in hospitalizations, but nothing close to what we were looking at with the Delta and Omicron. So we're continuing to monitor. We continue to have vaccination clinics in the community, and they're small, but there's still a demand out there. So we appreciate the work that we're able to do with with our partners from the community. Lastly, I'm sure you're all aware that following a ruling from a federal judge in Florida, the CDC ended the mandate for masking on public transportation, and CDPH followed suit. So right now, I think the masking mandate is only still in effect in LA and probably the BART, but otherwise all the others, it's now a strong recommendation. Important to remember, we still do have a masking mandate for healthcare systems or settings, as well as jails and shelters as well.
Thank you.
That's the end of my report.
Yeah, so we're in pretty good shape that way. Not like we've seen before, although apparently this is so much more infectious than the previous variant, which is amazing.
It is, and we are seeing people who are vaccinated, boosted, double boosted, still coming down positive, much milder disease, but I think we can safely say that the vaccine is effective in preventing severe disease and death, but people can still get the disease. So for people that have chronic conditions that put them at risk, I think it's important for them to make sure that they continue to wear masks in public places.
Yeah. Well, thank you very much. Any questions for Dr. Cassier? Okay, and I'm not seeing the chat, so, okay.
Carla, it looks like Steve has his hand up.
I just
They
have-
are up in the corner, hard to see the hand.
Hi,
Steve.
just a quick question. Dr. Kassirier, I think the Board of Supervisors is meeting in person. Do you anticipate that for other boards and committees for the county?
So long as we still have the emergency declaration, boards have the option to continue to meet virtually and still meet the Brown Act requirements. But once that ends, then we will be required to meet in person. The board did choose to start meeting in person. I think actually they were doing it even before, except for the period of time where we required that boards meet virtually.
So that begs a question, and maybe Siobhan or have some insight. Any word yet on the issue of the emergency order for suspension of the Brown Act? Is it looking like we'll all be back in person, or is there going to be a hybrid option? Big question.
Maybe I'll let Dr. K from a public health perspective talk about that first.
I think people have really liked being able to have the virtual option, but I don't know if there's any thought of changing the legislation after the declaration ends.
Yeah, and I have not heard of any thought of changing the legislation, and that's, you know, that is something that is bigger than Sacramento County. It's a statewide, so we'll have to wait and see. But I think Dr. Kassirier is right. I think we've learned a lot during this pandemic, and we've learned how we can actually increase access even to some of these meetings when we can be virtual. And so I know there are discussions going on. I'm just not certain the timing of all of that.
Okay, thank you. Okay, if there are no more questions, we will move on and ask Dr. Damiano for an update from Primary Health.
Good afternoon, Sandy Damiano. I'm with the Primary Health Division, and I don't know if you have my document up. That I'm not
We
sure.
can bring it up
on the screen.
I'm going to ask that it be shared.
And my report's brief this time because I gave a lengthy one last time.
Cynthia, are you able to pull that up?
Yes, I'm trying to get to it now.
Awesome, thank you.
Okay. Oh, where did it go? It's not letting me.
I can go ahead and.
Okay.
Oh, you got it?
Thanks. No, go ahead.
All right, I'll go ahead and pull it up.
Thanks, Liz. It's a lot easier. So we can go to page 2. I have 3 reports. The first one, I know the group has been interested in the average daily population of the jails. And on this graph, you can see the 3 years. This morning, we were up over 3,400 inmates. So we've been creeping back up. We had our low during COVID of 2,400, and we're kind of going back the other way at this point. Okay, next page. Okay, for our COVID report, we just did the dashboard this morning, so it didn't make it on this report, but we had no new cases for the week. I'm a little nervous with the new Omicron variants and what we're seeing countywide and statewide, because it usually gets reflected incoming into the jail. But you can see here the confirmed cases in the main jail and the branch jail have been relatively flat during March. So that's been going on. We've continued to do vaccinations for inmates. So this week we did 80 doses of vaccinations, 31 new initial doses, 38 second doses, and 11 boosters. but it's getting harder to vaccinate because inmates aren't seeing problems in the facilities. Usually if they're seeing problems with more infections, they're more willing to get the vaccination. So we'll see how that goes. On a positive note, we are seeing more incoming arrivals, arrestees that are coming in already vaccinated. Next page. This report is a little hard to get through, but we do a quarterly data pull, and it involves getting information on a snapshot in time. This was on April 5th. We get it from the Sheriff's Department, who's in custody on April 5th. We move it through our electronic health record for our correctional health to see who's matching up with the mental illness diagnosis and who's had treatment. And then ultimately we send that to behavioral health. So you can see on this chart, I wouldn't go so much by the sentence and pre-sentence because people can be sentenced and also have new charges. It gets very confusing. But you can see that people with a serious mental illness or those with a mental health disorder, but it's not a serious mental illness, tend to have a little bit longer lengths of stays. And if you scroll down, you can see for that particular day, we had 3,336 inmates, 2,138 received at least one service by our mental health team that works in the jail. That could include just initial assessment, or it could include ongoing services. So about 27% had a serious mental illness. That number has been stable since we've been doing this data pull, which started in 2020, relatively stable. Those with mental health disorder, but not a serious mental illness, that one is 37%. That's creeped up a bit during the pandemic, which makes some sense. If you go to the next page, you can see that we in the jails had served about 2,138 inmates during their stay during incarceration. Mental health takes that data and washes it through their avatar system to see who is actually open to service at that point in time of April 5th, or who was discharged. And what we find is that almost the entire group, this is 91% on this particular data pool, had been previously served by either county mental health or county alcohol and drug programs. And only a small percentage were continued open, and you could see those figures there. So if you're interested in any more of that, it takes 3 data sources for us to do this. It's kind of a lot of work, but it's been interesting. We do have data posted for multiple months or multiple data pools on the Sheriff's webpage. Okay, and that's my report for today. So I don't know if you had any questions.
Sophia Baltazar?
Oh, I'm sorry. I just realized I was
Okay, there's a hand.
unmuted already. But I did have a
question.
question.
Sophia, it
Dr.
seems like you
Hi,
have
Dr. Damiano.
more than one of your devices. If you could mute one of your devices, we're getting a lot of background noise.
Okay,
Thank you, Liz.
sorry about that.
That's okay. You sound great now.
Yeah.
Okay, that's all good. So I was wondering for the snapshot in time, would this be from like the previous, like the last snapshot we had, the data from the April 5th snapshot?
I'm not sure what the question is. Are you talking about the mental health population in the jails?
It was for the previous vaccination snapshot from April 5th. I was wondering if that was like the most, yeah.
I'm not sure what are you referring to the part of the graphs that I showed you, or are you referring to vaccinations?
To vaccinations.
Okay, I didn't put any vaccination data in this report because I did last time. We can provide another point in time report probably next month if that's what you're interested in.
Oh yeah, sorry, that was, I wasn't actually was not able to see the first half since it wasn't loading on my screen.
The report will be posted on PHAB's website if you want to look at it again. We'll get it up
Thank
on.
you so much.
You're welcome.
Thank you.
Thank you.
Libby, you have a question?
I did. Yeah, I had a question on the open to services table, just to make sure I'm understanding that correctly. And so the definition of open to services, does that mean they are actively enrolled in or engaging in a service at the time, or they are receptive to and open to future engagement?
So they're actually open to the service, but right now at that point in time, they were incarcerated.
Mm-hmm.
So when they got out of the jail, yes, they could return to their service provider. And that's what our staff will do, is refer them back to their current service provider.
And this is just a picture then of who is willing to be connected once they're discharged? No.
No, these are people that are open to services. They have active cases in either mental health or alcohol and drug.
So sometimes we think of it as enrolled in services.
Yes.
Yeah, that's helpful.
You can think of it
Open to,
that
I
way.
think, can be confusing. Okay. Okay, great. So it looks like then there's a lot of opportunity to enroll or connect a whole lot of
Yes,
other.
correct, Libby. And so what happens when we look at patients, obviously, if they're open to a service, and it could be these mental health, drug and alcohol, referring them back to their existing provider. If we think they need a higher level of care, we are in conversation with mental health typically to see if they can have a higher level of care. If they're not connected to services, because our staff in the jails have access to Avatar, which is their EHR, we can look up where they were before, or we can note making a new referral to mental health for that individual.
I see. Okay, so connecting this with some of the other data in your presentation, given there was, I forgot, it was 27% or something had a serious mental illness.
Yes.
There's probably
Yes.
quite a number of folks, then we would need to look at the numbers, but who are not currently enrolled and would benefit from a connection to service.
Yes.
Yeah.
So
Okay.
that's the goal of our staff, is to get those connected.
Great. Okay.
Mhm.
All right. Thanks for helping explain that.
No problem.
Terrific. Are there any other questions? No. Okay. Once again, PHAB, thank you so much for providing this very helpful set of data and sort of good news in some aspects of it. So that's good. And, thank you again, Sandy. We can move on, and Andrew Mendoza will give us an update from substance use and prevention treatment.
Good afternoon, everybody. Thank you, Farla. Just a quick couple updates from the substance use side of the house, and then I'll turn over a few minutes over to Michelle, my colleague, who will give you some updates on our Healthy Beginning programs, some of our perinatal initiatives. We are continuing to work on our countywide Narcan project, which is our main goal is to have Narcan available out in the community far and wide. I want to make sure that we want folks basically tripping on Narcan. We want it everywhere, every possible location. We're looking at all kinds of delivery methods, including vending machines, harm reduction partners, out in pharmacies, out in hospitals. We've been talking with a couple of the EDs in the area about sending folks home with Narcan. And also we're working with our partners over at Loaves and Fishes to try to make sure that plenty of Narcan is out there for folks to take with them when they come by Loaves and Fishes and other areas that folks receive services at. So our goal is to get it out there far and wide. If folks have ideas on where we might want to have Narcan available at, feel free to email me or anybody in my unit, and we'd love to put that on the list. We haven't quite finalized where we're going to have it available at. There's a lot of things that have to be done in regards to allowing things in folks' lobbies and all of that goes with giving out. Technically, Narcan is a prescription medication. So we have to work around that as well. So we're excited to continue to work on that project. Thanks so much, Siobhan, for your support and for your department's support on us rolling this out. Just a couple other things I wanted to highlight. May 8th through the 14th is National Prevention Week. We're working with all of our prevention providers in SUPD, making sure that they are getting the word out about prevention. And we're also working with our prevention partners to make sure that they're really getting the word out about treatment. We see that those two can sometimes be siloed. We want to make sure that our prevention folks are reminding everybody about treatment, and treatment reminding everybody about prevention. So we want to make sure that they're working together. We're going to be working on some meetings as we come back in person more, so that both sides of our unit, the prevention and treatment, can actually be talking to each other and in the same room, so they can leverage each other's resources. May 10th is the first ever National Fentanyl Awareness Day. No surprise, everybody on this call. In this meeting, fentanyl continues to be a huge issue here in Sacramento County. Recent data from our coroner's office continues to show an upward trend in deaths related to fentanyl, specifically, in regards to folks under the age of 18. So we're doing a lot of work out in our schools, out in the community, to make sure we get the word out about the dangers of fentanyl and counterfeit medication, counterfeit pills, out in the schools and everywhere we can. And also with that, getting out Narcan in all of those locations as well. May 12th is our Meth Coalition meeting, and See Her Bloom. I'll put some information in the chat for folks if you want to attend that meeting. May 25th, we're very excited to be partnering once again with the District Attorney's Office and several of our stakeholders to have the second Fentanyl Awareness Town Hall. So this will be led by my boss, Lori Miller, and some other folks who will be getting a lot of subject matter experts out into the same room and talking about fentanyl and what we can do to combat the fentanyl epidemic that we're seeing in our area. So that's it for kind of ours. I'll put all this in the chat for folks, but I'm going to go ahead and turn it over to my colleague, Michelle, to give a perinatal and our Healthy Beginnings update.
Thank you so much. So our Perinatal Healthy Beginnings initiative is going quite well. Part of our focus is on reducing prenatal substance exposure and referring women into treatment early to reduce the negative impacts on children. So one of our goals is to screen pregnant women for substance use early in pregnancy and send them into our department for treatment. We're currently looking to partner with a number of different agencies who are interested in screening pregnant women. So if anybody is interested, we have the screening tool called the 4Ps Plus, which is validated and research-based, which we have purchased and will be provided by the initiative at no cost to people who are interested. We also have our website and social media account, which is up and going, to reach out to providers in the community and women who are in need of substance use treatment and services, to encourage them into getting into early treatment. And our trainings will be coming up in May 23rd and 24th. So if anybody is interested, I will go ahead and drop that in the chat. And again, those are also no cost for any providers interested in Sacramento County.
Thank you so much, Michelle. That sounds great.
And one last thing, again, I just got reminded, because this is a recording and folks listen afterwards, email address if folks need to email me in regards to Narcan ideas, it's Mendonza, A, MENDONSAA @saccounty.gov. Looks like there's a question.
There are a couple of questions. One that was put in the chat is, what is the status of needle exchange in the county?
We're continuing to look at that. We're working with our harm reduction partners as part of the Narcan distribution project that we're looking at. We're trying to bundle a lot of harm reduction into this approach. I think initially there'll be Narcan going out, but we want to eventually provide condoms, pregnancy resources, all of the other harm reduction services that we want out there on the streets. We're going to try to pair up with as much as we can. So I don't have an exact update in regards to a needle change, at least from my unit's perspective, unless public health has something from their perspective.
Yes, there are two agencies that are approved by the state for needle exchange, and that's Harm Reduction Services and SANE. And we are part of that approval process. I think they get reviewed, I think once a year or every 2 years, and get reapproved. And there's some things that we also have to monitor with the work that they're doing.
Great. There's another question. Lynn?
Thank you so much. Michelle, I'm just wondering if, what's the process so a woman takes this test, it's returned to an office to test, to get the results. And then the results is the person then called to offer this service? How does that process work?
Yeah, let me explain a little bit more. The 4Ps Plus is actually not your typical urine screen. It's not a urine screen at all. It's a validated measure where people are able to answer questions about their substance use. And the way it's worded very carefully to really reduce shame helps women be able to openly discuss their substance use with their providers. And then people who are taught to do the screening then use some techniques which we call I am concerned, another validated measure and technique that helps women talk about their substance use, and then they are sent for treatment and provided referrals for treatment right at the time. So they're not getting called after. It's really a one-on-one with their provider to discuss their substance use, discuss concerns, and refer them for treatment.
Thank you.
Great. So any other questions?
It looks like there's another question in the chat, Farla, from Phil.
Okay. Are there discussions about safe consumption sites, overdose, whoops, what is it, it's moving, overdose prevention sites in our county? Have we seen emergence of parafluorofentanyl or metonitazine or xylazine in autopsy findings?
Thanks, Phil, for your question. We have not began really in-depth conversations in regards to safe consumption sites. I think Lori and I definitely want to talk to you a little bit more about that and kind of what that might look like. I know that's something that Lori's interested in as well. So perhaps we can maybe chat like we did before. In regards to kind of doing a drill down on what we're seeing in autopsies, unfortunately, our coroner's data is kind of more high level, where we just basically get, is it fentanyl related, fentanyl and meth related, or meth related? Those are the three categories of data that we get currently. Certainly, I can talk to our partners at the coroner's office and see if there's any more distilling down of that data that we can get, if you feel like that would be helpful.
Yeah, the reason I bring it up is I know that San Francisco has seen a surge in some of these other fentanyl analogs and other agents, and xylazine is really showing up across the country. And so I just want to make sure that we are aware, because I think if those aren't hitting our drug markets yet, they probably will in the near future. And some of these are extremely potent, and so we should be aware of them if they're showing up.
Excellent. Yeah, I will put that on my list when we talk to our coroner's partners and see if we can get that. Thanks, Phil.
And Farla, there was just one other question that was answered in the chat. I'll just read it out, which is what will be the cost for Narcan? And then Michelle responded, Narcan will be provided at no cost.
Great. Thank you, Liz. And thanks for asking that, Ashley. Okay, so thank you very much, Andrew and Michelle, as always. Sounds great. And hopefully we can help you in some of those endeavors in some places. And I'll send some suggestions to you, actually, Andrew, and see what we can do. Let's move on then to Dr. Ryan Quist and an update from him. Behavioral health services.
Good afternoon. I think there's a lot going on. So I think there's a number of different initiatives that we're working on. I'm not sure which ones you'd like me to spend the most time on. I know that you mentioned wanting to hear a little bit about our RAND report. Is that where you'd like me to
Yes,
start?
that would be great. Thank you.
All right. So as a part of the state budget, there's $2.2 billion in behavioral health infrastructure. They're calling it Behavioral Health Continuum Infrastructure Program. The idea is that they would like to build out the availability of facilities to be able to serve our various behavioral health needs. So these funds are for the acquisition, construction, renovation, whatever you need to do around increasing the capacity of behavioral health facilities to meet the needs of each individual community. These are competitive proposals. So there's not a single allocation for each county. They are split up into regions. So we share a region with a number of other counties around us. And then we go through a competitive application process in order to be able to apply for those funds. They're rolling them out in a series of phases. The first phase closed March 31st. They have weird terminology because they call that first phase of facilities. Actually, they call it phase 3 because it's sort of lumped in with some other non-facility related projects. But so in terms of actual facility projects, though, the first phase was concluded at the end of March. Here in well, I should back up to the other part. So then next piece of information is that statewide behavioral health directors got together, and through our joint powers of authority called CalMesa, which stands for California Mental Health Services Authority, we commissioned a study through RAND to look at where the gaps were among our adult acute care, subacute, and residential beds. And so they did a pretty thorough study around the state, as well as compared it to national benchmarks around what the need is for these beds. And they have released the results of that study, and I will try to pull up my screen if I'm allowed to. Then I'm going to look like I'm not looking at the camera because I'm looking on my other monitor. Did I do the wrong one? I think I did the wrong one. There. Are you able to just see the one document now?
Yes.
All right. So this is a Superior region. You can see that the different counties that are all comprised of this region. What they concluded, so this is the short version, straight to the punch. The entire report, which is apropos of RAND, is extremely methodologically complex and provides all of their methodology for how they reach these conclusions. And I certainly share that report if there's interest. What they concluded is that Superior region does not have a shortfall of acute psychiatric beds. Instead, we have a shortage of subacute beds. What are subacute beds? Subacute beds are step-down alternatives, typically for helping people who are ready to discharge from an acute facility. So they're no longer in an emergent acute situation as it relates to their mental health circumstances, and they're ready to step down to another level. An example of this would be a mental health rehabilitation center. Mental health rehabilitation center is typically a secured, locked facility where people are served for around, sometimes less, sometimes more, 18 months, where they would be able to continue to develop life skills and the other skills that they may need in order to be successful in returning to the community. Residents are typically conserved individuals, they're conservatees typically. And right now, we see here in Sacramento County, our experience really seems to align with these conclusions. Our length of stay at our acute facilities are much higher than you would see around the state. And the reason why we would see that is because we're having challenges with being able to get everybody that we need to out of the acute facilities into into the subacute facilities. So the whole concept here is if you're able to free up a bed in an acute facility by moving somebody to a subacute facility, you will basically free up an opportunity for another admission into that acute facility, which would help depressurize the stress in our emergency departments that we're seeing. So we're working towards developing out our subacute continuum. So I started with the Behavioral Health Continuum Infrastructure Program. In the context of that overall funding possibility Sacramento County has identified 3 primary priorities for the community, and those are mental health rehabilitation centers, youth crisis, and SUD residential. So as a part of those 3 priorities, we are talking with a number of partners because I'm not a construction person, right? I'm a service person. So in order for me to be able to develop new facilities, really having to lean on our various partners and colleagues in the community around what are some different options that we have. We've been meeting with our health systems, our hospital systems, pretty much anybody that would be interested in having conversations around this in terms of helping us develop our facilities in these 3 priority areas. And so for the first round of facility funding that closed March 31st, we did put forward a proposal for 64 bed mental health rehabilitation center. So we're looking forward to hearing back on how that goes. So this is what the RAND study shows, is that we're on a shortfall of 401 subacute beds, and then that's followed by a shortfall of 69 residential beds. In addition, I'm going to stop sharing now so we can look back at the camera again. In addition, this particular RAND study really focused on adult acute beds, adult beds, and it included the entire region. So Sacramento County reached out to Cal Mesa. I reached out to Cal Mesa and said, hey, can we do that again, but just do it just for Sacramento County? And in addition, we'd like to expand the analysis to include youth beds, and we'd like to include SUD residential beds. And so we did that, and the results are hopefully going to actually be finalized sometime today. So I don't know that I'm able to share, except that the advanced drafts I saw were that it was once again coming with a similar sort of a conclusion, is that we're short on subacute beds, not particularly short on acute beds. The good news is that it actually gives us more concrete numbers. So as we're applying for these behavioral health continuum infrastructure program dollars, we want to find the Goldilocks number of beds that we need, as opposed to overbuilding or underbuilding the number of beds in any one area. And this study is going to help us figure out, what is the capacity that we should actually build to, so that we don't get ourselves out over our feet regarding the different types of beds that we need to work towards. I think that's my main presentation. It looks like a couple questions. Happy to field those questions.
Yes. Let's take Liz's question first. And I want to mention there's a conversation in the chat. So Liz asked, were incarcerated populations included in this study? And there was an answer from Glenn. So perhaps we can start with that. Glenn, would you like to repeat your answer to Liz, and then we'll go on to the other questions? Am I seeing a Glenn? Okay, I'm not. Okay, the answer, and I'm not sure who Glenn is, so.
Yeah, Glenn, it looks like his speaker's not working, so maybe Dr. Quist could answer that. Yeah.
I'm sorry, I missed.
Oh, there you are, Glenn. Sorry, yeah, I don't want to blindside you. I'll read it and then Glenn can comment or Dr. Quist can comment. The study looked at bed capacity across the continuum. It considered acute state hospital beds in acute capacity analysis, and same with subacute. It was agnostic to where state hospitals fit on continuum. So if anybody wants to add on to that, please do. Otherwise, I will go ask about the other
So just
question.
to clarify, yeah, state hospitals are not, run by the sheriff's department. So I guess I was just curious for both studies, both the statewide and the county specific one, if currently incarcerated individuals, and we know that there's a cycle in and out, but was that population included? And if so, why not? Because I think it's really critical to understand, that population in this context.
So they were included. They were included in the, because it's a population-based estimate based on the total number of residents. So unless so it's not that they were excluded, is what I'm trying to say. It's not that they were excluded, but they were not drawn out as a specific subpopulation for analysis. So they would be, I think the estimates though would be included for the full community's needs. And then I saw Siobhan start to come off mute.
I was just going to add, I know there's some other consultants doing analyses on the populations that are currently incarcerated and what their potential needs would be in this space. And so I think it will align with the RAND study in terms of bed capacity once folks move out, what we need, but it also needs to be leveraged with the consulting reports that we anticipate getting that are specifically looking at the incarcerated population, if that makes sense.
Yeah, great.
The only other thing I'd add on the state hospital conversation is that is a state resource and not controlled by counties. We are buying as we have people waiting for state hospital beds, and so we will transfer folks to that as soon as they let us. In terms of their capacity, I think since there is a waiting list, that sort of tells me that there's not enough of those beds. The state has signaled that they're not intending to build out any additional state hospital beds.
Thank you. Libby had a question, and then Corinne.
Yeah, thanks. Thanks, Dr. Quist. My question actually just kind of builds on Liz's, and I want to just unpack something you just said a little bit more. So you said that the needs were based on a population-based estimate. Can you just expand on that a little bit? So what is the methodology for estimating the county or the region's needs? I know we haven't had a chance to read the detailed long report, but it'd be helpful to understand where that benchmark is coming from.
You're definitely asking a question that's going to get me out of my comfort area. My days of doing research are long past.
I wonder, Dr. Quist, if it wouldn't be helpful for us to allow the report to be released by RAND, which it's not fully released. Let the group actually dive into the details, and then we can come back next month and answer questions and maybe even schedule a time. I think RAND is scheduled to go and provide the presentation and report to the board at some point. We'll agendize that.
Well, we're gonna have community presentations. We included as a part of our contract with RAND for them to come out and be able to present to folks, because obviously I'm hitting the end of my comfort level with getting into the nuts and bolts. So there will be community opportunities to attend presentation by RAND and be able to send your questions their way.
Okay, great. Yeah, if you'd be able to share those opportunities, that'd be something that'd be helpful for all of us to understand, just so we know how to interpret those numbers.
Absolutely.
Thank you.
Corinne.
Hi, good afternoon all. This is Corinne McIntosh Sacco, and I'm attending as a member of the public, but I do want to make it known that I'm also a member of the Mental Health Board. And building on the past two speakers, the Mental Health Board is looking at the behavioral health needs of individuals that are interacting with the criminal justice system and how they could be best met. So being able to factor in the needs of the individuals that are currently detained in Sacramento County main jails, I think is really, really significant, especially given the information Ms. Damiano shared at the beginning of this meeting about 64% of the current jail populations receiving mental health services during incarceration and 27% of those having a serious mental illness. It does seem like there is a logjam in our continuum of care, and really looking at that so we have a county specific view, I think is really important. So I look forward to RAND being able to share those results, and when the county specific report results get finalized today. Thank you.
Thank you. Are there any other questions? Is there anything in the chat I'm missing? No. Well, we certainly appreciate your attendance and update, Ryan. That's great. It sounds like there's a lot in that report, and it'll take a while to digest it all, but it certainly looks like there's a path forward. I had one question about these competitive grants. So is my understanding that when you apply for them, that you're applying as part of the region? There were a number of surrounding areas that were lumped in. Is that part of the RAND report lumping, or part of the state competitive grant application?
Yeah, and I don't think that the state's lump or grouping is the same as what the report does, because the report had to do it based on what data they had available in a regional sort of way. So it's doesn't quite line up. But to answer your question more directly, the way that the funds are set up is that there's a pot of money for each region in each phase. So each phase has a certain total allocation, and then for each region, there's a sub allocation for that region. And so when you're applying for it, you're applying to say, I want to build a facility in this region. And so then the funding would come out of that particular pot.
Okay, thanks for the clarification.
It's selected, right? It's competitive.
Yeah, okay, well, good luck.
Cross our fingers.
Yeah, and I guess you continue to apply for different funds in the various phases, is that right?
Right, so the next phase, thank you for, I didn't finish that story. Next phase is in around September, October, and that phase is going to have a focus on youth facilities. And then they have not yet announced what the there'll be 2 more phases after the youth phase, and they have not announced the focus or prioritization for those 2 phases. So we're still waiting for further information on that.
And so the RAND report only looked at adults, is that correct?
The statewide report only looked at adults, and then the Sacramento County specific version looked at youth and SUD residential in addition. And
have you released the county report, or I
No,
think that's
not
early,
yet.
right?
I'm crossing my fingers it gets to me today. So of course, my first step will be to tell my board of supervisors about it so that they hear it first. And then happy to share that in other circumstances. And like I mentioned, there's going to be presentations that RAND is going to be able to schedule and facilitate.
Oh, that'll be great. Kudos to the county for requesting that specific report. That's great. So needed. So I and many others will be eagerly awaiting the release of the findings.
Great. Thank you.
Okay.
Carla, there was one more question in the chat from Lynn. Okay. Will the youth part of the analysis include transition age youth?
Trying to remember how they split the age groupings. I think it's based on the facility definition. So based on the facility definition, facilities are they'll make a distinction for 18 years and older, and then 17 years and younger. So I think obviously transition age youth are included in there, but the way that facilities determine which beds are appropriate for an individual coming in will depend on that age breakdown.
That's interesting. Okay, I look forward to seeing that as well. There was also a question, will we see the results of the county results in future meetings? So I presume we can ask you to come back when, after you've briefed the Board of Supervisors and get another update from you?
Sure. I would probably like to recommend that maybe you hear it from the experts and participate in that RAND presentation. Because as you can see, when you start asking specific questions, I'm not the researcher, so that might be a better venue to get your specific questions answered.
So hopefully, if you can advise us when those are, I will make sure that the board members hear about it.
Great.
Thank you so much. Okay. All right. Appreciate all of that.
It looks like Steve's hand is up, Farla.
Oh, Steve, you're in the corner of my screen and that little hand gets lost.
We'll do a peripheral vision exam on you later. Just a quick question for Ryan. Do you have any sense right now what percentage of beds in our county are contracted to or used by counties to the north?
No, we do not have that information. Trying to remember if the study might have some information along those lines. They did ask some questions about Anna County stuff. Let's look and see in the report when it gets released if there's any information along those lines in there. But that is a blind spot that we have not had that information historically.
I think it's important that since we have acted for a long time as a catchment center for so many counties to the north, that whenever there's an analysis of county needs, we also have to take that regional view. It's not likely that Alpine County or some of these others will build a psychiatric facility at any level. So they end up coming down to Sacramento. So we have to obviously be able to accommodate that.
Yeah, and I'm hoping some of our neighboring counties have thought about building some smaller psychiatric health facilities as well, in order for them to be able to provide for the psychiatric needs that are closer to home, rather than having to send them further away and coming to this area. But we'll see how that all plays out, because again, it's a competitive bid process, as opposed to it being awarded to some of these smaller counties who may not have the infrastructure to be able to successfully compete for these funds.
Okay. Any other questions that I'm missing? I don't see anything in the chat. I don't see any hands. So, okay. Thank you very much again. And we'll move on. We have a guest, Erin Mowry from First Five, Sacramento. We have not heard from First Five for a very long time, and I'm very excited to hear your presentation. So welcome. And Liz or Cynthia, if we can bring up Erin's attachments and presentation. There we go.
Oh, good afternoon. Thank you, Farla, for having First Five present to the committee and doing a screen share. I really appreciate that. I made some abbreviated notes. I won't take too much time, but excited to share about First Five Sacramento and the open seat that we have on our advisory committee. So just a little bit of background about First Five. We are part of Sacramento County. We have been around for 24 years, and we are funded through Proposition 10, which is a tobacco tax. So basically, First Five is a funding agency, and we fund programs for prenatal to age 5 and their families. And so that is our mission, to make sure that children have a healthy start in life. And our funding is dependent on how many births there are in the county. So as an example, there is a First Five in all of the 58 counties. So the funding stream is vastly different, say from Sacramento County to LA County, even to smaller counties like Modoc County. And so that is how we get our funding that we put out to community agencies. And so what is really unique about First Five is that every First Five decides what their funding is based on the community needs. So again, as what the needs are in Sacramento County are very different from what they even are across the way in Yolo County, even to Placer County. So at the first 5, we are focused on 7 areas right now. One of our main investments is to decrease African-American child death. Our number 2 is increased utilization of medical, dental, and mental health services. 3 is to improve breastfeeding rates. 4 is to increase access to affordable childcare. 5 is to increase quality practices in early care and education settings. 6 is to increase school readiness for kindergartners. And lastly, our second biggest investment is the use of effective parenting skills and to decrease child maltreatment rates. So through that, we fund maybe up to about 24 agencies, community government agencies in throughout the county. For example, we fund WIC, Birth and Beyond, Her Health First, just to kind of give you an idea where what kind of programs and services we have. First 5 is governed by a commission. Dr. Kay and Siobhan, they sit on our commission. And a part of that is a technical advisory board, similar to PHAB, which we call the advisory committee. And like PHAB, we have a designated seats for certain county boards, and the one for PHAB is currently open. So you look on the screen, there's just a little bit of information on what the advisory committee responsibilities are. And again, it's very similar to what PHAB is. It's just basically advising the commission on emerging issues. We rely on the advisory committee to gather information and share what these trends are in the community. What are some sustainability and systems optimization efforts that we can do, and advise the commission when we meet monthly. So the commission meets monthly, but the advisory board only meets 6 times a year on Friday at 2. So that's basically it in a nutshell. Does anyone have any questions? Okay, fantastic. Cynthia has the information and she could send it out to you with an application and just a little bit more, and you can always reach out to me, but we would be delighted to have representation from PHAB. So thanks again. Oh, Steve, you have a question?
Actually, it's more of a comment. So our last representative to First 5 was Dr. Jeffrey Rabinovitz, and he reported that it was one of the most gratifying experiences that he had to actually be on First 5, because this is a very important commission. There's a lot of money flowing to some important programs around the county, and there's no reason why we can't find a good representative from PHAB to join in on those efforts. You'll probably find it to be a very satisfying experience. So just putting a plug in because it's worth it. Thanks.
Thanks very much, Steve. I definitely appreciate that. It's a great group of people. I oversee that board and truly enjoy the community involvement.
So there are a couple of questions. What is the annual amount that First 5 allocates?
So it is dependent on births, and the birth rate pretty much stays around the same, about 20,000 births per year. And that is how our funding is. Since we are a tobacco tax and we are part of our mission is to smoking cessation, so the funding does decrease. So currently right now it's at $12 million annually that we receive. As it's been decreasing over several years, we've had to make a tremendous amount of cuts, which would be to programs. But through some fabulous sustainability efforts, like the advisory committee, we're able to keep it around $12 million a year, which is fantastic. And we just announced at our commission meeting on Monday that we aren't at a fiscal cliff anymore. So no more cuts in our next strategic plan, which is fantastic.
Wonderful. There's another question in the chat. When are the meetings?
The meetings are, they're on Friday from 2 to 3:30. The next one is in June. So right now they're virtual. As was mentioned earlier, it depends on if we can keep virtual, as many people want to. So just 6 times throughout the year, every other month, but the next one is June. And if you're interested, you fill out an application, then we send it to our commission for approval. But if you would just like to join the next meeting in June, just to be, you know, in the audience or on Zoom, just to kind of get a feel for it, please join us.
And also, Erin, you did send that information for your meetings on a chart, correct, to me? And I'm going to send that out to everyone today. And so that way they'll know when the meeting dates are.
Fantastic. Thanks, Cynthia.
You're welcome.
Any other questions? No? Okay. Then we will move on. Thank you so much for being here and supplying all that information. And hopefully we will get somebody on 5 very soon. I'm sure we will, actually.
And Steve, do you still have a question, or is your hand?
I'm seeing his hand up, and I'm just wondering. No? Okay, he's muted. He took it down. All right. Thank you again. And I will forward any questions if they come in late. Okay, thank you. Let's move on. All right. I think we're going to, we're ahead of schedule, which is a great thing. Not unusual for us. So there's hope that we'll end early. The next agenda item concerns PHAB's activities and planning, especially around the committees. I want to let everybody know about the timing of the Board of Supervisors agenda item that we had requested. And currently I'm seeing that it is on May 10th, scheduled for 2 o'clock now. I'm not sure. I think it was at 3 and now it's at 2. Siobhan, would you like to let us know? I believe Eric Jones is asking for 30 minutes also. So they allotted more time for this. Is that correct?
Yeah, so basically what will happen is PHAB will give the report to the board, and then Eric and I will just spend a few minutes at the end of your report, just kind of adding to some of the things that the county is currently working on that addresses some of the recommendations. So typically when we allot 30 minutes, when the board allots 30 minutes, it oftentimes will go over, so we're not stuck to a certain time frame. But yeah, we just ask that if you know the length of your presentation, that's helpful for us to know ahead of time. And I think we talked about that already.
Yeah, we did. And hopefully, what are the chances that it will actually be heard at 2? Are those good? I'm not sure what else is on the agenda.
I would say no. I would say, I would be prepared. Oftentimes, things that are scheduled go a little bit after the time that they're scheduled for. So it really depends. It's very difficult to predict how much public comment will be on the items before. I think they're trying to get better at, having some actual good predictions, but I would just intend that you could probably be there for the rest of the afternoon, potentially.
Okay, so heads up to all the members who are thinking of joining in. That's something to consider. Thank you. We all look forward to that. There have been a lot of meetings going on around this. I don't know if, I'm not sure Sanal had another meeting, so she's not on, but we continue to meet with interested parties concerning the youth mental health presentation, and that includes the county Board of Education representative for us, which is Bina. She's been very involved in this, and so we appreciate that. And you've seen the presentation, I believe, in its final form. So the members of PHAB at least know what's coming. And concerning the working committee, if Libby wants to give an update, but we've also been very busy meeting lots of entities still, including individually talking to the Board of Supervisors. We hope that we can really bring some emphasis to the areas that are needed before the budget is finalized, and so that a lot of the resources that are really critical in these areas can be allotted to them. Any comments about that? Any questions?
Siobhan has her hand up.
Wow, it's on, you know, on my screen, Siobhan, it's on your bulletin board and it has the same color.
Yeah, I could barely see it myself.
Yeah, no problem. I just wanted to mention, I think Farla, you had said May 10th. It's actually May 11th at 2 p.m. Yeah, I just wanted to clarify and make folks knew that. So thanks.
I thought I said the 11th. But
maybe you did. I think I heard 10th.
That. No, we want to be clear. I don't want anybody logging on and figuring, wow, this isn't it.
Yeah, thank you.
Thank you. Okay. Any other questions about that? No comments. Okay. So we can move on. The other agenda item is concerning retreat, and that means a retreat for PHAB. I don't think PHAB has ever held a retreat. Steve has a longer memory than I do, longer tenure. So it was a thought I had once I was hearing of other boards doing this, and I thought, wow, we're not even meeting in person. I'm not sure when we will be meeting in person. But for I guess, just getting members to know each other and to talk, and probably in person if that's allowed at that point. We never know how things are going. They're looking good now, but I think meeting in person and spending a few hours discussing our interests, individual interests, the interests of the board, what we've seen, where we've brought our advice to the Board of Supervisors, how we've gotten it to them. All of that we can look over, as well as where we're going and our emphasis in sort of evolving in a sense. Now we're bringing an agenda item to the board. We haven't done that for a long time. And I think this past year has been really interesting in terms of this past year, I guess, annual year, calendar year of 2021 has seen a lot more public involvement, public engagement. I think it's a good time to stop and look at ourselves and see how we're functioning and how we can function better also. So I would like to hear from the board members what you think about this idea. It could be arranged maybe in the evening, maybe on a weekend morning. There's a lot of options. We're looking at venues for it. And I'd like to encourage you to think about it, to enter things in the chat if you have ideas now about those options, whether you think it's a good idea for a retreat, if you'd like to schedule it, what would be better for your schedule, for instance, and we'll try and accommodate most people. If you have thoughts on how to convene this in terms of focus, what you'd be interested in, I'd love to hear about that. If you don't want to enter it into the chat and think about it later, I think we're okay if you email me. I'm trying to figure out if we're in compliance with the Brown Act by doing that. I think that's okay, just not having a lot of serial meetings. If you want to talk to one other person about it, that's fine, but not having them then go to another board member. So just cautionary comment about that, but definitely would love to hear what you're thinking. because we won't be meeting in July, I thought this, the time between the end of June and early July might be good. That would be good to hear what your preferences are on that consideration of timing. Let me see, I have Steve put something in about the Human Services Coordinating Council, which I had a comment about later, so I'm glad you brought that up. They have a yearly retreat and it's a weekend afternoon, lunch is served. Generally, one of the supervisors attends and makes a presentation. Very successful. That sounds very promising. And another comment about the weekend would be good, or evening. So glad to hear about that. Both of them are very interesting, adds to the mix of what we can do. I was thinking about food because whenever we supply food, I'm sure people come. That's always the best way to do things, over food. So any comments at all? Okay, gonna think about that. Oh, the Mental Health Board, another comment, thank you, Corinne, that the Mental Health Board held its retreat virtually for the past 2 years, all day, and we've used a facilitator. Oh, good idea. Happy to consult. Thank you so much. I'd love that. Take you up on your offer. Sounds good. The more ideas, the better, and from people who have actually had more experience with it. And I also want to say that while we're on the Human Services Coordinating Council, I believe there's also a position open on that council for a PHAB member. So if anybody's interested, two positions. Oh, that's correct. That was you and Paula. So Steve and Paula Green, a previous PHAB member, served on the Human Services Coordinating Council, and we asked quite a while ago, a number of times, for people who are interested to represent PHAB on that council. Steve, would you like to say a couple of words about what they do?
I think it's just important to know that structurally, PHAB reports to the Human Services Coordinating Council, along with a lot of other very important boards and commissions. The Aging Commission is there, and Youth Commission, and a variety of others. So it's actually a reporting place. We can sometimes see county issues with a larger lens, since more groups are involved in making in adding to this group. It's also meeting once a week. Right now, I'm sure they're virtual. I think they meet, as I recall, on a Wednesday at noon. No, not Wednesday. I'm sorry, I forgot the date, but it's also a noontime meeting for an hour and a half. And they.
Sorry, that was once a week or once a month?
Once a month. Okay. I guess I need more caffeine. So anyways, it's another opportunity for people who are involved with PHAB to also understand what is happening in a broader sense with input from these other groups into Human Service Coordinating Council. So I would encourage people to consider that as well.
Excellent. And I believe their meeting schedules might also be attached to the agenda. We have a list of associated boards. So you can look at that for more information and let me know. I can put you in touch with other people for more information. I also wanted, let me see, there's one other, hold on just a second. Okay, sorry, I'm reading the chat. There is a comment about the retreat, and it would be interesting to hear how we can make the board more interactive and increase engagement and energy. It would be great to hear ideas from PHAB members themselves on what would make PHAB more engaging for them, but also for our county colleagues on what they would like to see from PHAB going forward. So that would be very interesting as well. And I'd like to just mention that the executive board for PHAB will be reaching out to the members in a phone call to hear from the members, our members, some of that as well. What would be engaging for them, and have a conversation on a one-to-one basis with one of the executive members. So look forward to getting a call. Anything else? I think we have some interesting suggestions, and we will proceed with gathering more information from our members and seeing more possibilities for where we can hold it and when we can hold it. Okay. Anything else before? Is there any public comment we haven't heard from before? I encourage the public to comment during the meeting, but if there's anything here at the end, please let us know. And seeing nobody's hand, seeing nothing in the chat, I will say we can adjourn early. So thank you very much, and enjoy the early summer weather. And I guess it's, we'll see you in June. Thank you.
Thanks.